Polycystic ovarian syndrome is a problem with the hormones that happens during the reproductive years. If you have PCOS, you may not have periods regularly, or your period will last for a few more days. Or you may have too much of the hormone called androgen. Androgen is often called the male hormones, but androgen is found in both male and females, but in smaller quantity in the females. Androgen helps in growth and development in both male and the females. I'm Nasiba Muhammad Al-Amin, a registered nurse and a new mom who had PCOS. And I'm here to share my experience with you. If this is the first time you're following me, please do subscribe and don't forget to like and share and tag your loved ones. If you're a returning subscriber, hi. In PCOS, many small fluid-filled sacs develop at the outer edge of the ovaries, and these are called cysts. These small fluid-filled sacs contains immature eggs, and these are called the follicles, and the follicles fail to release eggs regularly. The exact cause of PCOS is unknown, but factors that might play a role include 1. Insulin resistance. Insulin is a hormone that the pancreas makes. It allows the cells to make use of insulin. This is your body's primary supply of energy. If the cells becomes resistant to the action of insulin, your blood sugar level can go up, and this in turn can make your body to make more insulin in an attempt to bring down your blood sugar level. Too much insulin might cause your body to make too much of the hormone androgen, and this in turn can lead to problems with ovulation, a process whereby eggs are released from the ovary. One of the signs of insulin resistance is dark velvety patches of skin under the neck, groins, armpits, or under the breasts. Weight gain and large appetite are other signs. White blood cells make substances a response to infection or injury, and these responses are called low-grade inflammation. Research shows that people with PCOS have a type of long-term low-grade inflammation that leads polycystic ovaries to produce androgens, and this can lead to heart and blood vessels problems. A family history of PCOS is known to be one of the causes of PCOS. With PCOS, the ovaries may produce a large amount of androgens, and having too much androgens may interfere with ovulations. This means eggs aren't produced on a daily basis and aren't released from the follicles where they develop. And excess androgens can also lead to acne and hirsutism. Symptoms start around the time of your first menstrual period, but symptoms can occur also while you had your period for a while. Symptoms vary depending on the type of PCOS you had, but diagnosis is made when you have 2 to 3 of these symptoms. Irregular period. You may have fewer than 9 periods in a year, and these periods can occur 35 days apart, and this can lead to trouble in getting pregnant. High level of androgens can lead to excess facial and body hair, and can also lead to cystic acne. It can also lead to male pattern baldness. Your ovaries might be bigger, and many follicles containing immature eggs may develop at the age of the ovary. There is no single test to specifically diagnose polycystic ovarian syndromes. Your healthcare provider may start a discussion about your symptoms, medications, and other medical conditions. Your healthcare provider may also ask about your menstrual period and some weight changes. Some physical examinations, which include checking for excessive hair growth, acne, and insulin resistance, may be recommended. Your healthcare provider might then recommend some other tests, such as pelvic examination, to check for masses, growth, and other changes. Blood tests may also be recommended to measure the hormones levels. Blood testing such as glucose tolerance tests to measure your body's response to sugar, fasting cholesterol and triglyceride level. Ultrasound will also be recommended to check for the appearance of your ovaries and the thickness of the lining of the uterus. If a diagnosis of polycystic ovarian syndrome is made, more tests might be recommended to check for complications, such as regular checks of blood pressure, glucose tolerance tests, cholesterol and triglyceride level, screening for depression and anxiety, screening for obstructive sleep apnea. The prevalence of infertility in women with PCOS varies from 70 to 80%. Infertility, which occurs in 70 to 80 women diagnosed with PCOS, gestational diabetes or pre-diabetes, pregnancy-induced hypertension, non-alcoholic steatohepatitis, that is an inflammation of the liver that occurs due to buildup of fat in the liver, metabolic syndromes, a cluster of conditions including high blood pressure, high blood sugar level, unhealthy cholesterol and triglyceride level that significantly increase your chances of developing heart and blood vessels disease. Type 2 diabetes or pre-diabetes, sleep apnea, depression, anxiety, and eating disorder, cancer of the uterine lining, that is endometrial cancer. Weight gain commonly occurs with PCOS and can worsen the complications of the disorder. Next on the list is the treatment of polycystic ovarian syndromes, and this includes medications and lifestyle changes, and also dietary changes. Join me in our next episode to explore the dietary changes, lifestyle changes that are being used for polycystic ovarian syndromes. Bye bye.